And we'll get started.
Hello, this is the Mandelbaums in Des Moines.
Hi, Mandelbaums. You guys, I knew you were from a different time zone because you were an hour early.
Oh, that's all right. We're waiting on your time zone.
Did you get my message? I put a message in the chat room saying you were an hour early.
Oh, we didn't see it.
No, I didn't see it.
Oh.
But thank you. We appreciate that. The concern.
How many people do you have signed up?
24.
This morning we had 40.
Great.
So we'll see. All right, what do you think, Holly? Are we ready?
Hi, everybody. It's 6:32. Why don't we wait 1 minute and then we'll begin?
Okay.
How many are on? Do we know anybody else that's on?
David.
All right. Lauren, shall we begin?
Yeah. Welcome, everyone.
I'm letting everyone know this is being recorded, but not just so people are aware it's being recorded. Okay, go ahead, Lauren.
Okay, great. Thank you. And welcome, everyone. We're so excited to have you here. My name is Lauren Park, pronouns she, her, and I am the chair of the Tikkun Committee at Har-Shem. And my co-host tonight is Holly Berman, cantorial soloist at Har-Shem. And we are just thrilled to collaborate with Boulder County tonight for this educational program. Given the new wave of discrimination the transgender community is currently facing, we feel that discussions like this are a crucial first step so that we can learn and we can better support the LGBTQ community, and we can be allies, which is really the most important thing. This program is the first in a series of programs on this topic. In 1 week, on April 29th, Holly will be facilitating a second program at Har-Shem. It will be an intimate conversation with 3 young adults who grew up at Har-Shem and who now identify as transgender or non-binary. All 3 have continued to have connection to the Jewish community, and all 3 are willing to tell their personal stories. So that should be really interesting. And then on May 4th, the JCC Exceptional Women Series will host a talk with
Lauren has frozen up. So I'm going to speak for a moment and then we will begin. But I think she was going to say that I think it's May 4th that Abby Stein is going to be speaking. Oh, there, Lauren, you had frozen up, so I started speaking.
Oh,
And so we didn't hear, you started to speak about the event with Abby Stein, and then you froze up. So I took over, but would you like to say what you were saying again?
oh, I'm so sorry. Yeah, so on May 4th, the JCC Exceptional Women's Series will host a talk with Abby Stein. She's the author of Becoming Eve, My Journey from Ultra-Orthodox Rabbi to Transgender Woman. And she will share her story of leaving the Hasidic world and exploring a self-determined life. So those two events will be coming up soon, so please check them out. One housekeeping item is that we will have time at the end of the presentation for Q&A. So if you have questions for either speaker, then please type them into the chat. And now I'm going to introduce our two speakers. Mardi Moore is the Executive Director for Boulder County. She's waving. A Colorado nonprofit with the mission to educate, advocate, and provide services and support for Boulder County's LGBTQ communities. Under her leadership, the organization has grown fivefold in 7 years. Prior to leading Boulder County, Mardi held senior level positions in New York City with the National Gay and Lesbian Task Force and the New York City LGBT Center. She has worked for the past 30 years to elevate the rights, visibility, safety, and socioeconomic status of the LGBTQ communities. Josie Nixon came to Boulder County in 2016 seeking support for their transition and fell in love with the organization. Since then, they've held many different volunteer positions at Boulder County. Although they moved to Denver, Boulder County will always be their queer home. They are dedicated to the sustainable growth of identities, diversity, and the equity of queer communities in Boulder and elsewhere. Josie uses all pronouns. So please welcome Mardi and Josie.
Hi, everyone. My name is Mardi, she, her, and hers, and it's nice to see you all tonight. And we're very appreciative of this opportunity to talk about, do a little bit of education. For some of this, that may be old hat. For some of this, that may be brand new information. So we're excited to have this opportunity. As Lauren mentioned, the politics of the times have the transgender community targeted on a number of levels, from sports to bathrooms, there were some changes today that Joe Biden did that are going to be helpful. But every day it's kind of a new day in the LGBTQ community in either having a discrimination lifted or having a new one put on. So we're on our toes all the time at Boulder County. We're going to start tonight with Josie doing some education. And I'm going to share slides here in a minute. And then I'm going to go in and talk about our programs. As questions come up, please drop them in the chat. And Lauren, feel free to interrupt any of us at any time, either Josie or myself. And we're happy to answer questions as we go and try to make this as interactive and fun as possible, because that's something about the queers. We always like to have fun. So even if it's education. So we'll try to bring some fun tonight, and we hope that you will too. So on that, I'm going to try to figure out the technology and share my screen, and we'll get started there.
Great. So I will start us off. Again, my name is Josie Nixon. I use all pronouns. I do currently live in Denver, but have been a supporter of Boulder County since the moment I called them from my apartment while I was living in Michigan. So I moved here in 2016, like Lauren said, and came out here specifically to transition. I didn't think that living in West Michigan, graduating from a school named after the DeVos family was really the place that I wanted to explore my gender identity and my sexuality. So I had really an intention to come out, to move somewhere where nobody knew me, where there was an established community of trans people, services, and access to care. And one thing that I think Mardi is well aware of, my high opinion of her, but she has done an incredible job to step up for the trans community. And throughout her 7 years without Boulder, I think she's really established Boulder County as a place where trans people can be fully included and completely understood in the context of LGBTQ inclusivity. We are oftentimes at the center of conversation, and it's been really wonderful. And when I found the organization, I really just gave them a call and pretty quickly decided that I was going to move to Boulder. And then I did show up just living out of my car for a little while out of necessity, and got put on hormones, and then started going to the gender support group throughout Boulder. And they, I think, saw something in me that I'm learning to see in myself. And I started rising through the roles of volunteer, working as a front desk volunteer, sitting in on staff meetings. I always made sure to volunteer on Tuesdays so that I could sort of eavesdrop and hear about the happenings. And then I started facilitating the support group. Then I joined the Trans Steering and Events Committee shortly after, became the chair of that committee. And then when I moved to Denver, I did have to step away for a minute and just did what I could. But Mardi has said this to me when I first started this job. She's not wrong though, is that I effectively just bugged her until she gave me a job. And fortunately for me, it only took 4 years. And I know that that's, to me, it seems like a long time, but the longer I've been in this community, the more I see that we've had community members for decades. And it's because of the work that we're doing that they stick around. So I'm incredibly proud to be a part of this organization, and really happy to be here with you today. All right, so slides. We are going to just do a little bit of education, talking about the gay agenda, as some of us like to call it. So we're just going to go over some terms for you, just a little bit of conversational pieces that will help you navigating spaces with LGBTQ people. And then Mardi will touch on some of the work that Out Boulder's been doing and some of the priorities that we have going forward right now. All right, so these terms you've probably heard by now. They are all over the place, and just to do a quick overview, most of these are going to be specific for the trans community. So just to make the references very simple and put it in context for everybody, I'll just talk from my own experience. So my sex assigned at birth is basically what they told my parents when my mom gave birth to me, and they exclaimed that I was a male. And then pretty quickly in my own life, I learned that my gender identity did not match my sex assigned at birth. And I started to express a lot of feminine feelings. I felt very uncomfortable when I started going through puberty. But it wasn't until my 20s when I started to show a variation in my gender expression. So the difference between gender expression and gender identity, right, is gender identity is how we feel on the inside, and gender expression is how we feel on the outside, or what you might see when you're looking at me. And then past that, not specific to trans people, is sexual orientation, which can be lesbian, gay, bisexual, pansexual, queer, can be sexual identity as well. I want to reiterate as well, I think any questions that folks might have, please don't hesitate to just ping me. I think that might be a little bit more accessible than trying to remember until the end. So every person, everybody in this room, everybody that you know, has a sex assigned at birth, a gender identity, and a gender expression. the thing that's particular with trans people is that those usually don't align right down, so from your birth, I got assigned male. And the reason that I'm trans is because my gender identity and gender expression sort of vary from that line. And what we call cisgender people are folks whose gender identity matches their sex assigned at birth, and their gender expression typically follows a similar line. We can head to the next slide. I think I touched on one of the points already. So there you go, cisgender and transgender. One thing I will note is that these are adjectives. They are not verbs. So I have never in my life transgendered. Nobody has transgendered. A good way to rephrase that would be to say, Josie has transitioned, or Josie is trans. We could say Marty is cis or cisgender. So we wouldn't say somebody is cisgendered. And then further than that, within the transgender umbrella, which is probably the best way to look at it, transgender being sort of the overarching term that gets used for the community, there's different segments inside of that. There's trans men, there's trans women, and then below that you can see non-binary, genderqueer, gender fluid. And then if you're on the internet and you follow anybody under the age of 18, there's a new term coming about like every month. And it's just really wonderful to see. I think when I was growing up, I didn't even know transgender existed. So to see just the ability that young folk have in navigating their identity and exploring new things is really exciting. So we'll dive a little bit further into non-binary terms. So go ahead to the next slide, Marty. Non-binary is different from being a trans man or a trans woman. If you were assigned sex at birth is male, and your gender identity and expression is that of a female, you're a trans woman, but you can still identify within the binary of male and female. So then the opposite would be for trans men. And then there is the very common stream of thinking that the gender binary is not an exclusive binary system. It's not a 1 or a 0 or a black and a white. There's a lot of gray space and space on the outside and inside of those terms. So that's where non-binary people find their identity and where they're comfortable with themselves. So gender, can fall anywhere along a spectrum. It's not, yes or no. I actually really love this little comic here. I get asked pretty often if I'm a boy or a girl, and typically I say yes or no. It kind of just depends on the situation. So if you think that that's just like a funny comic, it's actually a very good representation of my life. And I think it's just really important to remember that there's ways to be really respectful while also not understanding. And you don't need to fully understand how I feel about myself, the same way that we don't need to understand fully how Marty identifies within her femininity to just have a general respect and common courtesy towards them. All right, so then into some of the more common terms that I'm sure we all do know. Gay, lesbian, bisexual are all pretty common. Queer has gone through many shifts in the last few decades. When I was really young, I got called a queer when I was being bullied or teased. And then by the time I came out as queer, people were starting to use it as a term of endearment and a term of their identity. So I actually identify my gender and my sexuality as queer. I think it's easier for me that way. My gender and my sexuality are very fluid, and they don't stay in one place very often. So that can be just an easy way to express that flexibility. And then if for anyone who might not know, pansexual is a term that got brought about when I think the trans community started to speak about how bisexual wasn't representative of non-binary people. So you could be bisexual and be attracted to men and women, and then trans people that are non-binary were like, hey, that doesn't include me, and there's people that are attracted to me, what do they call themselves? So that can be a good use for the word pansexual. And that's obviously like a very surface level understanding of that word. So please don't take everything I'm saying like to heart as the only definition. The next action items that we can go into, just what we can do as a community of people. I think inherently we are all good people, and we want to create an environment that makes people feel welcome and loved and included. And I think especially in communities of faith, that's a really important thing. So just having the understanding and going to sessions like this can be a great way to do that. The next slide is just some ideas to keep in mind. I love the thought that LGBTQ people are everywhere, and I think you coming to this session probably indicates a willingness to learn and understand. But I actually was on a call today, and it just made me feel really inspired to know that as the nation continues to go through major shifts, I think it's important to remember that more and more kids are feeling comfortable. A lot of it's probably due to access to the internet in representing themselves authentically and saying that they might not be straight or cisgender. And LGBTQ people are everywhere. And there's a really, really good chance that you know them personally in your life, even if they might not be out of the closet to you. So it's just really important to always embody respect. If you wouldn't say it to somebody's face, I mean, that's a little cliche, I think, but if you wouldn't say it to someone's face, don't say it at all. And then it's a second to that, within the community of LGBTQ people, we represent, we are in every community. We are in the military, we are Jewish, Christian, we are Muslim, we are Black, we are white, we are Asian. We come from every part of the globe in every religion, and some of us like guns and Donald Trump, and some of us like, I know, sorry y'all, but there are some of us, and I just am trying to make a point. I can only see Lauren's face, but I'm reading the room off of that. So I appreciate your expressions, Lauren. But we really represent every idea, and there's so much more to us than just our sexual or gender identity. Like I'm a very interesting person. I don't want to toot my own horn, but I have a lot of stuff that I do. And most of that is not completely revolving around the fact that I am trans or the fact that I am queer in my sexuality. So it's just important to remember that, within every hobby, there are LGBTQ people. One great thing to do when you're interacting with people is to show that same level of respect that you would expect people show you, and to not ask private questions. I think the really classic one is asking trans people if they've had a surgery that you might be curious about. And we understand that there is curiosity, and curiosity is one of the main human drives that keep us going. But it's also important to remember that you don't ask random people about surgeries that they've had. For the most part, I don't even ask people, what color their underwear is. So I wouldn't ask, what's underneath of their underwear. So that's an extreme example, but very representative of what trans people do face when we could just be going to the grocery store and somebody's curiosity sparks and they want to know more. We can head to the next slide. So these are just some tips. I won't read them out for you, but effectively it's a similar notion when we're creating a space like this. You'll see that Marty and I think Lauren and Holly all have our pronouns in our Zoom names. And what that does is it just shows an effort of inclusivity. It shows that we know what pronouns are, and if someone else in the room is experiencing some gender confusion, they don't know about themselves, they can see that we're making an effort to make them feel included and safe. This is an extension on things that we've been doing for years and years and years. And this is sort of just like the next step for communities to take to create that inclusivity. I think another one of the trends that I'll mention is sometimes when you go to a meeting and there's an introduction that includes the Native American lands that we live on. I know in Denver, I'm on the Ute, Cheyenne, and Arapaho territories of the Native Americans. And what that does is creates an awareness of anyone who's in the room that might be Native American, who understands, I recognize their existence. And it's the same sort of thing. It's just for the trans community, we can use things like this. One in particular that's not listed on here that I actually really love is using the term theydies and gentle thems, which has gotten a lot of hits. So feel free to take that if you'd like. You can head to the next one. So pronouns, these are super important. I mentioned these a moment ago in our Zoom names. So there are a lot of different pronouns. I honestly couldn't list them all to you. There are some ones that are very common, like he, she, and they. So when you ask someone's pronouns, that is just another step we can take to create that inclusivity, to make sure people do feel seen. And then also we're not assuming what somebody's pronouns are. So, some of the examples here would just be to say, like, asking what someone's pronouns are. If you don't know, if you can't tell from looking at somebody, or there's even a slight hint in your brain that that person you're looking at, that you're about to walk up and say hello to, that you might not know their pronouns, it's really wonderful to just walk up and ask, because it is the safest way to do it. Trans people are very familiar with the question, and we love getting it because it makes us feel safe. Like, if you ask me my pronouns and I tell you that I use they, them, and theirs, I know that you're going to make a concerted effort to then use the appropriate pronouns for me, which is very just the kind and inclusive things to do. Some of the other ways to do that that are really easy would be to put them in your Zoom name, to put them on your social media profiles, to put your pronouns in your email signatures, things like that. Super simple, and just shows your support for the community, I think. So I mentioned they, them, and their. That is a pronoun that I use pretty often, and it can be a little bit tricky to get used to. Getting my parents on board really showed me the difficulty that can happen for people that aren't surrounded by the community like myself. So it's really important that you practice using they, them, and their pronouns, especially if there's someone in your life who uses those pronouns, because if you're consistently getting them wrong, even if you're polite about it or trying your best, it can still take a toll on that person emotionally. And if you think about it, we've been using they, them, and their in a singular sense for a really long time. If we, an example that I used to use a lot is like, if you walk into a coffee shop and you see a backpack on the ground and you also see somebody walking out the front door, you might turn to your friend and say like, oh my gosh, they left their backpack here. And so you just did it. Like, congratulations, you've just used they, them in a singular sense. And it can be that simple in our brains to just make that like, oh, I have been doing this all the time. I just need to say it the right way. Kind of like when I moved out here and I had to start saying soda instead of pop because I grew up saying pop. I do think it's the better of the two, but I've conceded because I can't help it. Okay, you can head to the next slide. So mistakes happen. Of course, trans people understand that everyone is still making big shifts. We first and foremost appreciate the effort that you put in. I think intention is 9/10 of that. So if you have good intentions, if you are, you know, you have a smile on your face and kindness in your heart and you make a mistake, that is okay. The trans person that you're speaking with is going to see the intention of your kindness, and that's going to mean the world to them. What you can do from there to best correct yourself, like it says here, is correct your mistakes. So if I were to say, you know, talking about Marty, if I said, oh, well, you know, he, oh, excuse me, she, and then you keep talking, you're talking about whatever it is that you, what you need, what point you need to make. There's no point in dwelling on your mistake. We know that it can be embarrassing to make a mistake because it's always embarrassing to make a mistake. So just keeping in mind that if you do mess up, apologize, correct yourself, and then continue with your day, continue with the conversation. And that will show the trans person that you're not making the apology about yourself, you're not centering yourself, and you're also not putting that trans person on the spot. But that is it for me, everybody. So I'm gonna hand it off to Marty, and then I'll be here the whole time. So if there's questions specifically about what I talked about, or if you have questions about my life as a trans person, I'm also completely an open book and happy to answer anything. But I also reserve the right to say no if I want.
I'll reserve my question. Before I share slides again, I wondered, Lauren, are there any questions? This might be a place to open up and see if there's any questions from folks about any of the ideas and material that Josie presented.
So I think I'm going to field questions. I don't mean to interrupt Lauren if she's going to answer as well. And I've answered a couple notes in the chat about people saying how amazing this is. And I've answered that, but I have not seen any questions in the chat, but please folks feel free to do so. And I will make sure that they are asked. And I want to say that people are very, very deeply appreciative and grateful for this open and kind conversation. Oh, now I did just get a question because now that was a cue. So someone is wondering if, I know we spoke briefly about pansexual, and it was shared that it was kind of going away from the binary of male and female and to be, there's a difference between our gender and our attraction. And so in attraction, pansexual was talking about being attracted to all genders, meaning that it could be someone, a male, female, or non-binary. So I don't know if I just answered it, but the question is, someone asked, can someone define pansexual a little bit more clearly?
Yeah, I think that was actually a great example or definition. It's really, it seems like a stretch, like it would be hard to understand, but it really does just mean that you're attracted to people of any gender identity. So men, women, in between, outside of, above and below, it doesn't have much of a matter. Some people will say that are pansexual will say sometimes it's more about who the person is. And I think that might be true to some extent for everybody as well.
Thank you. Yeah, and it can be similar or the same as bisexual, but I think some people take concern with the word bi, meaning that binary and that duo, but it's another Zoom conversation between people who identify as bisexual and people who identify as pansexual, discussing happily the differences. But I think you've answered the question for now, so let's move forward. Thank you, Marty, and thank you.
Great. I was just curious. We were going to do polls, but we didn't plan ahead. So I'm just curious, in the room, does everybody know a gay, lesbian, bisexual, or pansexual person? Can you show of hands? Are we kind of there? There's a thumbs up. I can see people who aren't. What about trans folks? Do you have trans folks in your life? Well, and those of you who don't have your hand up, you do now, because there's Josie, and I've given you Josie's email. So now you know a trans person, and when your grandchildren come out, or your sons or daughters, or your husband or your wife, you'll have somebody to call, and that'll be Josie. So thank you for playing along with that. All right,
we have had a couple people digitally raise their hand, but I think it's up to you, but we can wait till the end to take further questions or whatever you choose.
I would honestly say the questions now, since the next piece that Marty is going to cover is less about gender and sexuality and more about the work we're doing as an organization. Is that okay, Marty?
I think that makes total sense.
Okay, so what I'm going to do, since there's a few people, I would ask, I might call on someone to speak, but then if the rest of you could write the question to me in the chat, I think it would just save us time as opposed to finding everybody and unmuting everybody. But I will ask, let's see, I will ask, so Shauna, did you answer, raise your hand? Okay, so Elaine, oh, okay, sorry, she took her hand. So Sheila, your hand is still up. Sheila, would you like to unmute yourself and ask a question? And can everyone else put their questions to me in the chat?
She might have just been raising her hand that she knew a gay person.
Exactly. Okay, so I'm going to let people put questions to me in the chat, and you go ahead, and I will gather those for the end.
All right, I'll unmute, try to successfully share a screen again. I don't think that's the one. Oh no, here we go. So a little bit about me before I get into the work. So I grew up in Colorado. I grew up in a little town in southeastern Colorado called Los Animas, rural community. And like Josie, not knowing a trans person, I never knew a gay or lesbian person. And there was one person who came to my dad's vet clinic that certainly didn't conform with gender, and I had no word for that, and she went by Mrs. Phipps. So there was a little bit of a mind expansion, but I didn't know what to do with it. When I got to the University of Denver, and I met some people who were like me, and my world just opened up. And my mother still thinks DU made me a lesbian, but that's a whole nother discussion and panel. So when I finally got brave enough, or I actually wasn't brave enough when I was in Colorado to tell my family that I was a lesbian. And so what I did instead is I moved to another state because I knew what the church had told me. I grew up a Methodist, and I knew what my family thought about homosexuals. And so I moved away. And I finally came out to them, and it went as poorly as I had suspected. And I was gone from Colorado for 30 years, living in Seattle and New York City. When I came back to Colorado 7 or 8 years ago now, one of the reasons I came back and took this job is that I wanted to make, and I still want to make, Colorado a place where gay, lesbian, bisexual, transgender, and queer kids don't have to leave their families in this beautiful state to be who they are. And I think you'll see that in some of the programming I inherited when I came to Boulder County, and some of the new things that we're doing. So that's a little bit about me. So at Boulder County, which has been around since 1994, those of you who have been in Colorado a long time know that in 1992, our neighbors voted to make it illegal by any state agency to provide us with anything. It was called Amendment 2, and it passed. And it tore up the LGBTQ community. The case went all the way to the Supreme Court in a case called Romer versus Evans. And Jean Dabowski, who's still in our community and a wonderful human being, took the case pro bono and argued in front of the Supreme Court. The law was never enacted, but many organizations that are around today, including out Boulder County, got their start shortly after that. Out Boulder County, we're still called Boulder Pride with the federal government, but it was a group of activists here in Boulder County who got together and wanted to make a difference. And so at that time, they had no space. Their first Pride parade was a block long. Now when we have Pride pre-pandemic, we'd have 15,000, 8,000 people at Boulder Pride and 5,000 or 6,000 in Longmont. But it started a block long. And I still have the baton that somebody twirled in that parade that hangs in my office. They also, at that time, had materials about coming out or where to secretly meet for a dance. And somebody carried all that material in the trunk of their car. And somebody had it for a week. And then when there was a hotline, so people could call in, this was way before the internet. I'm sure they were still dittoing materials somewhere in somebody's office. And then they would take the materials to that person. The next week, another volunteer would fill their trunk with materials. And that's how the organization got started. Since then, we've grown a little bit. However, my trunk is still full of materials. I'm usually going to one event or another. And at Out Boulder County, we do a lot of really great stuff. I'm really proud of the people who work at Out Boulder County and the work that we do. One of our most important programs is our youth program. Jenna Howerton, if it's Thursday night, they're probably meeting with youth right now. We have 3 different youth programs. One is on Monday night for middle school youth. One is on Wednesday night, and one is on Thursday night for high school youth. And they are planning, there's a big event tomorrow called the Night of Noise, which you can find on our website. Blitzen started an event years ago called the Day of Silence, which many schools will be participating in tomorrow. And it's where they literally will put tape across their mouth and or not speak for the day to bring attention to youth who experience bullying at school. And to make a point of that. Well, Out Boulder throws a party because we love to throw parties, and it's called Night of Noise. So we have youth interns who've been planning all this. They have some speaker that is a hit on TikTok or something like that, that I am not aware of, but I'll look forward to hearing them tomorrow night. They also do a youth dance, a queer prom every year. Well, last year being an exception. We're hoping in the fall we'll be able to do a dance this year. And then 2 years ago, we started a camp where we go into the mountains and they camp for 3 days, spend 4 nights, and hopefully we'll be able to do that again this year. We do everything from to provide youth with binders. Binders are something that you put across your chest to flatten your chest out to not suffer from gender dysphoria. We give instructions with those and safety things. I saw tampons on the other thing, so I'll use that as an example. You don't leave tampons in for days. You don't wear a chest binder for days. So we send those out. We also do a lot of work with the school districts. We serve both Boulder Valley School District and St. Vrain Valley School District. I have the cell numbers of both superintendents and I use them when necessary. And we have GSAs in most schools. It's been a tough year for everyone, including schools and GSAs and students. We do know that suicide attempts are up in our youth population. And so that's very concerning. We also were mandatory reporters in our programming. We did, in this virtual environment, we did more mandatory reporting than ever. Youth who actually got some freedom at school were now at home with parents who were not accepting. And that created some real problems. And then I think also teachers were doing more reporting, but we were seeing the youth consistently in our groups. So that was a sad turn of events, but we were glad that we were there for the youth. The other big program we have, and Josie alluded to it, and it was life-saving for Josie, and it is for many others, is our trans programming. So on Monday and Thursday nights, we run support groups, trained facilitators who hold support groups. And attendance, one of the things that we found in virtual attendance for the trans community is these Zoom things, gender dysphoria can kick off like crazy. If you're sitting looking at yourself over and over again. And so, we've given guidance on these Zoom things. You can hide self-view and some of those things. And so that's been a little tough. And attendance has declined some, but the groups are still going well. And I think there's probably 25, 30 people a week who reach out for support in that. Josie talked about the Trans Steering and Events Committee. We have a leadership group that helps me when the press reaches out, helps me to make sure that informs me on what kind of program we should be doing for the trans community, and also puts on events. I think 2 weeks ago, we had Trans Awareness Week and a Trans Day of Celebration, which were great events. One event was Latina asylum seekers. We have many asylum seekers, trans asylum seekers here in Boulder County who are with sponsors or working in the area. And they shared their, frankly, horrendous stories of ICE and their move from Central and South America into the United States. That was just one of the events. And then we did an intergenerational event. So every year we do a variety of events that go over 5 or 6 days. We also, our emails and our phone is often ringing for people looking for referrals. So one of the things about our community is they won't go directly to the police. They won't directly go to the domestic, to SPAN if they're in a domestic violence situation. They won't directly go to the homeless shelter. They come to us, tell us their situation, and then we do a lot of education about those organizations, which are great allies and great trusted organizations. And then I don't know how many times I've been on the phone with somebody as we've called SPAN to find services and a bed there. So we do a lot of those. People with legal problems. People think we know everything just because we're queer. And so they call with all kinds of interesting things. We get a lot of people looking for legal things around workplace discrimination in particular. Also some family law, if you're in a lesbian relationship and you're not really married but you're getting a divorce, what does that look like? Those kind of referrals. So we do a variety of referrals through our work. Parents are reaching out looking for support on a regular basis. We are also the people that bring you pride. And we're planning on that. It's going to be in June this year. We do a variety of events, a pool party, which I think is being canceled again this year because of COVID, which is the one day a summer where a trans person can swim and feel good in their body and not gawked at and dive in and jump and play. It's a fantastic event, but I think we're going to have to wait one more summer for that. So we do a variety of things. We have a weekly newsletter that goes out to, I think I just asked Charlie today, 3,800 people with an average 23% open rate, and it goes out every week. We share a lot of information from the Jewish community, and I think we partner with a number of organizations and share their information too. One of the things, we've all had changes based upon the pandemic, and Boulder County, so LGBTQ people as a whole, we all know the rich gays, right? And we want to hold them up, like Bill here. Kidding, Bill. Well, but the reality is, as a whole, the LGBTQ community is poorer, more likely to be in a service-related job, more likely not to have insurance or a trusted relationship with a doctor. Less likely to have a car. I mean, you can just kind of go down the list. When you talk about the social determinants of health, you'll find us that we don't rate very well there as a group. So shortly after the stay-at-home orders went into effect, Mikkel, who works on our team, crafted a survey and got it out to folks. And we found there that a lot of people had lost their jobs already. Unemployment wasn't coming. If you applied for unemployment, you may know these horror stories of not being able to get through. Apparently the people with fraud can get through, but the people who are accurate or who are real people are having trouble getting through. And so there was people didn't have access to food. Again, as I told you, they won't go directly to the food bank. They're going to come to Out Boulder and say, where's the food bank? If they can break down that pride to be able to reach out for that. So we found that our community was in pretty poor mental health and in really bad economic situations. The Human Rights Campaign out of DC did a survey, it's probably been 2 months ago now, and they reported that 1 in 5 LGBTQ people are currently unemployed. So what we did with the information that we collected is that we started seeking out grants. We first received a grant from the Colorado State COVID Fund, then from the city of Boulder, then from the Excel Foundation, and then from the county, Boulder County. And what we did, we'd never done this before, we quickly put together an application that was vetted. We pulled together a committee, because if I was gonna write the check, I couldn't be deciding who was getting the check. And we've given out over $100,000 in grants. And Out Boulder, we didn't take anything in administrative fees. We just wrote the checks. And the first round was all volunteer folks giving of their own time to review the applications. And then the next 2 rounds, we asked for some funding for their time also. So that's pretty darn amazing. And we just gave out another $30,000. All the checks went out in the mail in March. And so most of them have been cashed now. In that funding we received from the city of Boulder, they also funded, we're calling them a community advocate, but they're like a case manager. So when somebody's in those dire straits and they're telling us that their car needs fixed, they need mental health support, the check's gonna make them feel good for a little bit and maybe keep them in their house and get something to eat. But there's some long-term safety net places that they need to be plugged into. So our community advocate is working with folks who receive direct aid and also folks who reach out who are in bad situations. So those are new programs that we added. I'm going to talk about the vaccination clinics a little farther down the line. So we do a lot of advocacy work, and it's my favorite thing to do. And so in the city of Boulder recently, it went into effect after the lockdown. So as we start going out more, you're going to start seeing this. But the city of Boulder passed an ordinance through their building codes that now new builds and even existing facilities with single stall restrooms are going to label them all gender. So that's a big win for us. And they also changed the building code. It used to be very onerous to build a multi-stall bathroom that was all gender, and they changed the rules up a little bit on that. So now you could actually build something that's all gender. An example of how that's important is when Bank of America was building their new branch on 28th. One of their, I think she was in charge of that bank, was on our board for a while. And she really wanted to have all gender bathrooms. There weren't gonna be urinals, they were just gonna be bathrooms. And she couldn't do it. And so now somebody who wants to do that will be able to do that. And so I'm pretty excited about that. We do a lot of work with the county. One of the things that I'm most proud of, and I get in trouble in some circles in talking about it because police are problematic. But about 5 years ago, and I won't tell you what had happened then, but you can do the math. Hate crimes and hate incidents spiked. I had been here 3 years. I had had 1 hate crime cross my desk. And then within weeks of the inauguration of the former president, the phone started ringing off the hook. The emails were coming in. And within a year, we had, I think that the number was 24 incidents and or crimes. Simple ones with, nasty graffiti to real harm with hospitalization and hate crime charges being filed. So through that work, we started well, part of it was Jane Brodigan, the outgoing city manager who I miss in the city of Boulder. And one of the first tasks I was given when I came to Out Boulder was I was called to a city, Carmen Atzolano's office, and she said, Jane Brodigan wants the HRC municipal index to be much higher in Boulder, in the city of Boulder. What do we need to do? And one of the ways you could get 10 points was if you had a police liaison. So knowing that, I asked Jane for an introduction to Greg Testa, and then Greg connected me to some others. And so we are leading statewide an LGBTQ liaison program. And in the city of Boulder, we have 3 liaisons. And here's an example of how they work. So I get a call, this is, I think, right before the pandemic. I get a call from the city of Longmont asking me if I knew a person because she's trans, so I must know all the trans people in town, but I didn't know this one. And so I called, and they said that her phone was pinging in Boulder. So I called my liaison, and he started doing the research. And he's a police officer and I'm not, he's a detective. And he actually found where she was. And one of the great programs that a lot of municipalities, police departments are doing is they're pairing mental health with officers. And in Boulder, it's called the EDGE program, I believe. So Kevin got a couple of mental health providers with him, hopped in the car and found her, and because she was suicidal, and she was willing to go to the Out Boulder office. So we met there, the mental health people did an assessment, and then we were able to get her into the Boulder shelter. And now she's working out of the shelter, and probably has made a few of you coffees at Starbucks as of late. But I'm so proud of that partnership. And we've done trainings in the jails. We've worked with the sheriff's office. One of the things in Colorado, when you go to get your driver's license, you can check male, female, or an X marker. And it was something that One Colorado advocated for. I think there are 13 states where you can get an X marker, which some trans people or non-binary people may do. But the reality is, when you talk to federal systems, whether that be banking, whether that be the police and sheriff, whether that be getting SNAP, no systems work for that. And so the sheriff's office called us over with their data people, and they said, we want to collect this X, but we need to figure out how to get it into the federal system. So I feel like there's a real give and take and trust between agencies and organizations to allow us to serve the community better. We do a lot of work in St. Vrain and Boulder Valley schools, including a speaking out program, a trained group of LGBTQ people who go into social studies classes or health classes. And we're doing them on Zoom too, and talk about the LGBTQ experience. Of course, you have to be approved by the district to be able to do that. And we have all those approvals. We're currently working on a Senate bill around health equity. So we also do some work in the legislature. And related to the vaccine work, we're doing some congressional advocacy right now. And that brings me to the Colorado Department of Public Health and Environment and Boulder County Public Health. So right now, I wish I could see everybody's faces because these slides up, I can't. I'm wondering if everybody's gotten their vaccine. Because we need to get it, right? So one of the things that I feel like I'm the Forrest Gump of organizing and advocacy. So in December, so one of our board members had been part of the Boulder County task force on COVID. And so every month they would talk about a different issue, and she would represent the LGBTQ community, whether that was around mental health or that was about childcare, whatever the issue was, employment. So in December, all of a sudden the vaccines were available. So in that conversation, Dr. Gray said to the powers that be, would it be helpful if Out Boulder did a survey on LGBTQ feelings about the vaccines. And they said that would be such a gift. Yes. So we got a survey out, which ended up being the first in the nation. That's what I mean about the Forrest Gump. Just right place, right time. And what we found since then, the Human Rights Campaign and the Kaiser Family Foundation have done similar studies, and the findings have been similar. If you're a person of color and in the LGBTQ community, you have higher hesitancy. If you are a cisgender female, a bisexual female, or a non-binary person assigned female at birth, or a trans man, you have higher, we have found, these 3 studies have found, that you have higher resistance to receiving the vaccine. Our study now is being 10 or 12 organizations throughout the state or the country want to use our surveys, trying to figure out where their hesitant populations are. I don't know if you've heard the local news, but right now there are more vaccines than people want in their arms. We've already hit that level of hesitancy. And so we're working to address that. We have been working with Boulder County Public Health to do equity clinics. And we've been doing this in partnership mostly with Jorge at El Centro Amistad, who's become one of my favorite people in the world, does amazing work. And he and I have really directed Boulder County Public Health in how to provide vaccines and hopefully other efforts equitably. We have bilingual volunteers at all the spots. We are training all their volunteers and medical staff and registration staff on LGBTQ competencies. We have changed the signage in the Longmont Fairgrounds. Don't tell the cowboys, but we'll have to get that fixed before the fair opens up. But we have like changed everything up. We're working for the Center for People with Disabilities to make sure that all the spaces that you can get into where all the clinics are. So we've been doing, since January, a lot of my daily life has been taken up with vaccines in these clinics. We also did an amazing town hall, which is on our website under the vaccine tab with Boulder Community Health and some doctors from Beacon Clinic. There's some specific reasons that LGBTQ folks are hesitant. One is we lived through, those of us still here, we lived through the AIDS pandemic, and there's not a vaccine for AIDS. And seemingly, within 6 months, there's a vaccine for COVID. One of the areas of resistance. Up until 1972, lesbians like me were in the DSM as defective with a terrible mental health problem. Trans people are still kind of listed there. They changed one name and left us there. Again, we're less likely to have a trusted relationship with the doctor. So there's all kinds of hesitancy that we're seeing in our community. We're in the process now of developing an ad campaign, which should be really, really good. I hope to launch that by June 1st. One of the issues in working with public health systems, much like the census. So in the census, they don't collect data on real gender identities or on sexual orientation. So we're non-existent when they start doing this GIS data, which they're now working with to figure out where we need to get vaccines in communities. We don't exist. When they tested the vaccines, they didn't include broad samples or targeted samples of LGBTQ people. A lot of trans people, not all, are on heavy doses of hormones. Have there been any testing with heavy doses of hormones with these? No. A lot of people living with AIDS on heavy doses of immunosuppressants. Now I saw a report 2 weeks ago where the vaccines probably aren't going to protect people in those situations from COVID. It would have been nifty to be included in those trials. So then we don't have another level of hesitancy to work through, or to have people who aren't fully covered by taking the vaccines. So we have been doing work at the state level, at the congressional level. Diana DeGette is in charge of the committee that the CDC and NIH report to. So we have made our point loud and clear at that level. And it must have gotten somewhere, because the CDC Foundation asked us to apply for one of their grants to work on this project in our community. And I just got that submitted today. So cross your fingers on that one. So there's a lot of work to be done, to be seen in data. And I just see it as another level of discrimination. I'm not sure what the holdup is. That what they'll tell you is it's a cost issue. And I can tell you that there's a larger cost issue by not including us. Been spending a lot of time on that. I do feel like there's two pandemics happening simultaneously. We have the COVID pandemic, and we have a mental health pandemic. We are currently, so we did the survey in March of last year. So we're doing another one now that, a year out. The survey is still open. We've had 203 respondents. So I asked the data analyst to pull numbers for me today. And if this doesn't break your heart and tell us that we're in a mental health pandemic, I don't know what will. About 3 months ago, I was following Twitter Shea Castle on a Tuesday night when I was listening to the Boulder City Council meeting. And then Executive Director of Boulder County Public Health, Jeff Zayak, was reporting to the council. And he said suicide attempts and successful suicides were up. We knew before this pandemic that LGBTQ people have higher suicide rates than the general population. So, and we know that suicide is a lagging indicator of poor mental health. So what I had to look at today, and what I'm sharing with you now, is of 203 respondents, 18% of them have attempted suicide within the last 30 days. %, have a plan, and 30% were thinking about it. We had 2 people die by suicide within 6 days of each other 3 weeks ago. I just talked to one of the young person's mother today and went to a service on Sunday. So we have some work to be done. I really appreciated Josie's comments as they were training around the kindness. Like, you don't understand something, you don't have to understand something, you just have to be kind. And we lost a lot of kindness over those 4 years. And it's hard to get back. So we are developing a new program, our own mental health program. Well, let me go back to the slide real quick around the barriers. And this is exactly it. So some people don't have the capacity in them to reach out. And that's why our case manager is so important, to make those appointments for them, to make sure they get there. Cost of copay is too much. Lack of therapists, so you'll go into a waiting line. So they can't call them a waiting list for the most part, especially if you're Medicaid, because that's illegal. But what they'll do is they'll do an intake, and then you'll see them in 3 or 4 weeks. Then 26% said there's a lack of LGBTQ affirming therapists in their network. 15% said cost, and we all know there's stigma associated with mental health issues. So I've been working on this for probably just over a month. I'm kicking myself because I knew this was coming and I didn't move fast enough. We're a small staff. We work as hard and as fast as we can, but we got caught. So what we're doing is we're partnering with the Umbrella Collective, Lee Brookins runs. And we've hired some therapists from their group, which will be Medicaid. They have Medicaid. Most of our clientele has Medicaid or no insurance. One of the therapists is bilingual, and one is not. One is in the queer community. So we're in the process of putting that together and what that's going to look like. I think I will continue working from my basement because my office at work, we have a small space, is the best space for therapy because you can get in through a private door. So we're gonna make the best that we can out of a very small space to start providing that. We're also gonna start trying to catch people before they fall over or fall in the hole with doing some new programming, trying to get a spot at growing gardens, doing walks, go to the museum kind of stuff you can do outside this summer before fall hits again. So we're working on getting those together. Volunteers volunteer for a lot of reasons, including mental health, feeling good about what you're doing. We haven't been engaging our volunteers well because of COVID. So we're starting to engage people, I think, in better ways, and we can do more now that the weather, hopefully the snow is all but gone, and we can start doing some gatherings outside. The other thing that we're doing, and Josie can speak better about this because they've been heavily involved in it. We currently have a website called transhealthbouldercounty.org. And if you're looking for a therapist or a doctor or an electrolysis or a variety of things, you can click on there and they've been vetted before they get on that. So we're in the process of expanding that to the entire LGBTQ community. And that'll be, the lack of finding doctors. We're hoping to take care of that. And we think that can be a statewide resource where you'll be able to say, I'm in Pueblo, who's down here. So through technology, I think we can broaden that and save more lives. On this program, separate from the health of the new website, I'm in conversations with the Community Foundation of Boulder County and Boulder County itself to see if they will provide some of the startup funding. But we need to fund this new program while keeping our other programs up and running. So tonight, if you're so moved, you too can be a part of the mental health program. I'd like you to think, as we leave this and as you head into 2 more programs put together by the Jewish community, that you will stay engaged in learning, that you will practice using that pronoun they, that you will, when you walk into the bathroom that says men's room and there's no urinal in it, you'll think to yourself, why does this say men's room? That you'll just start questioning the way things are. If you're working in a big company, a lot of companies have employee resource groups that are LGBTQ specific. It's a good thing to join. There's a lot, at Seagate, for example, I think has more allies than queer people in it, but they have trans kids or gay kids or, a gay brother, and so they join. That's another way to get involved. Talk to your children and families, maybe listen to your children and families as they bring new information in, or share that I learned tonight that somebody uses they pronouns. What's that all about? And let them explain it to you. Supportive school policies. There's a lot of good work done by school boards. I can't believe anybody would want that job. Comes with no pay and a lot of grief and a lot of work, but they do some really good work. So when you see them doing good things for marginalized populations, feel free to send them an email and thank them. Sign up for our newsletter. There's great information in it. You might find something that you want to do. We have tons of allies who are part of our community, and we couldn't do it without them. And always feel free to make a gift. Outboulder.org is our website. And we'd love to answer any questions or provide resources to you in any way possible. Thank you.
Amazing. Thank you so much. It's humbling to know how much work needs to be done. And we're all grateful for the work that you're doing, truly. So I want to be respectful of people's time. So I'm just going to summarize a little bit the questions in the chat and then we'll finish up. But someone just wanted to make sure that we, or asked if we recognized that in the Native American communities, they have two-spirit and this idea of many genders. And so I wanted to name that, that was important to someone to recognize that precedes us. And then the other questions had to do with.
I will actually. I'm sorry to interrupt. I will actually speak on that for just a second. It's actually really great that gets brought up, because I think this is a little bit of a deeper dive, and so we don't have to get into it. But the idea of a binary gender system, men and women, is very much a colonial idea. When the Europeans colonized a lot of places around the planet, they brought with them the idea of men and women. And there's cultures all over the planet that recognized many different genders. Typically, they were spiritual leaders as well. So they were given a lot of respect, which is why they were so quickly eradicated, is because they were spiritual leaders. And the best way to commit a genocide is to eradicate the leaders. So that happened with the Native American culture as well.
Thank you, Josie. Thank you. Yeah, absolutely. The other questions that I want to talk about, there's a grouping of 3 questions that have to do with us being allies and advocates, naming that Hebrew is a pretty binary gendered language. And so wondering if you all have insight into how the trans community is dealing with that. And again, the issues around sports and transgender girls participating in sports, and how can we be allies and work on that issue. And then the third issue that this person raised is that oftentimes students and young people filling out forms like for standardized tests have to choose male or female, and is out Boulder advocating for change in that, just like you mentioned in the driver's licenses that we have X as a gender identity, and how can we help to make that change as well?
I'll start with the last. We've gotten Infinite Campus, which is what the school districts here use to be able to update that. The problem that we've run into since the pandemic is the legal issue on third-party apps, so Zoom and Google Meets and some other pieces there. We haven't been as successful. I do hear that Boulder Valley School District, which will announce soon, I'm sharing information, I think their lawyers have figured a way out around that, but I'll let them announce the really big news, so we'll have to look for that. And St. Vrain, I've still got a bit of a hold up on there. So once Boulder Valley does it, St. Vrain will follow. We know how that works. We are not advocating at the national level for those testing sites, but I can look to see who may be doing that.
Thank you. Oh, go ahead, Josie.
Yeah, I was just going to speak to the language barriers. So it's actually a really challenging thing to do, right? Language is one of the most fundamental things to our civilizations. So it's not unique to the Hebrew language that it's incredibly binary. I know the Latinx community is really struggling with that. A good friend of mine is an immigrant from Italy, and in Italy, they're having a very similar issue where it's incredibly gendered. And unfortunately, it's going to take some serious creativity.
I think Lior did it. I'm going to find you a resource, because a Jewish queer person. Yeah, I need to look and see. I think they spent a whole project doing that.
I follow Lior on Facebook, so maybe I can.
Would you send them a message and find that out for us?
There's a wonderful movement coming out of Boulder to address that. But and Josie, I agree with you that it's beyond Hebrew, and I was wondering if you wanted to continue speaking about that.
Yeah, it's just, I think sort of like what Marty was saying is we have to have activists like Lior take on that challenge of evolving what we all consider fundamental. It's sort of like the addition of pronouns that are being used. When I hear a pronoun that I've never heard before, I'm like, you know, where did that come from? And then what happens is somebody in, I mean, oftentimes it's like San Francisco or New York City or something like that. They're a social media influencer is a good way to do that now. And it catches on, people identify with it. And we have to have the support of communities in order for things to grow. So it can be things like that. And then I will try and find this resource about the Hebrew language before the meeting is over.
So I posted, so Rabbi Fred Green has joined us. And so
Hi, Rabbi.
Thank you, Fred, for helping me to bring that link to people. So I've posted in the chat a link to the work that's being done in the Hebrew language, opening up the Hebrew language. So thank you so much. That's wonderful. And he also mentioned that I will say that in Hebrew, in Judaism, we have 6 terms for gender diversity. So this idea of a spectrum of gender is precedes us and is in faith traditions other than the Native American faith tradition as well. And I'm going to ask one last question, and then I think if people want to stick around and ask questions, but I want to be respectful of people's time, that if someone is interested in becoming an LGBTQ affirming therapist, so if they are someone who works in social work or therapy, do they self-identify as such, or is there a process by which they can be named that?
That's you, Josie, your questionnaire.
Sure. So I think that one of the important things to remember is the community very much recognizes that there's a growing community or a growing awareness around the desire to be an inclusive provider of healthcare and mental health care. But the difference in being tolerant and being successful at providing care is really important. So everyone in this room, I would say, is here with really good intentions, but some of us have gone through extensive training, lived in the community, you know, sat through many conversations. And I would say that it's generally going to be seen as more advantageous to find trainings that are specifically for your field. The questionnaire that we're going to be listing for the resource that we're building for the LGBTQ healthcare website it's long because the LGBTQ community has a history of being discriminated against in the healthcare industry. So the reason why it's long and the reason why we want to know so many things is because it's a challenge to understand the dynamics of a whole set of diverse ideas and people and identities. So the first step is wanting to take that, is to start getting involved in conversations. I'm not sure, I'm not a therapist or a doctor, so I don't know if there's.
Oh, come on, go ahead and give it up. You're both.
I don't think I could qualify as licensed or anything, but I do think it's important to start getting involved in conversations with colleagues, with people that are doing the work that you're seeing that you want to support. So finding those trainings and community is a great step.
Yeah, I think there's continuing credit kind of stuff to get that. Also for the medical industry, there's a group called GLAMA, Gay and Lesbian Medical Association. And then there's also an LGBT committee off of the AMA. So there's some people doing some work in the medical field.
Wonderful. Wonderful. Thank you so much. I have to say that this recording will be on the Har Hashem YouTube page. So if people, you know, there's a lot of information that came quickly and you all gave us permission to put it there. So if you want to go back and review and understand, and in that light of continuing our learning and continuing our growth, and wondering how we can be supportive of you all, I can't thank you both enough. And so I'd like to end the program by asking Lauren if she'd like to say any final words.
Well, I just want to echo that we are so appreciative of your time, that you came and told us your stories, that you made this your life's work. It's just been very informative and inspiring. And I think we're all hoping we're making our way back to kindness. So thank you. Thank you.
Thank you. Thanks for inviting us, and thank you for your time this evening.
Yeah, definitely.
Thank you all. And you have our emails, and if people, you all shared your emails, and mine is hb@hearthashem.org. I'll put it in the chat if that would be helpful to anyone with further needs. Sorry, I'm having typing and talking at the same time.
The struggle of Zoom meetings.
Exactly.
Rabbi, it's good to see you.
It's good to be here. Sorry, I couldn't be here for all of it. There was a family in mourning. We were leading a service, but it wasn't hard to travel over to this new Zoom room. So I'm glad I was able to come for the last little bit, and it's good to see all of you.
Great. Great. Thank you all so much.
Good night.
Good night.
Good night.
Thank you. Good night.
Good night.